Welcome to Communication and Documentation Review. In this section, we'll explore how effective communication is essential in pre-hospital care, ensuring successful interaction with patients, colleagues, and other healthcare professionals. Remember to refer to your text for more information. Communication is the process of sharing information with another person. As an EMT, this involves both verbal communication, such as speaking with patients and colleagues, and nonverbal cues, such as body language. Strong communication skills are critical for gathering information, managing emergencies, and ensuring smooth patient handovers to other healthcare professionals. Documentation serves as the foundation of a patient's permanent medical record. It is used to demonstrate the care you provided, comply with legal requirements, and support ongoing patient management. Thorough and accurate documentation ensures the continuity of care and helps your organization meet administrative and research needs. To communicate effectively, EMTs rely on tools like computers, radios, and telephones. These systems link you to dispatch, medical control, and other emergency services. Knowing how to use these tools efficiently and understanding their limitations is vital for ensuring seamless communication during emergencies. Therapeutic communication involves using both verbal and nonverbal strategies to build trust and rapport with patients. It encourages patients to express their feelings and helps create a positive relationship. Mastering therapeutic communication is essential for delivering compassionate and effective patient care. The Shannon-Weaver communication model helps us understand how messages are transmitted. It involves a sender encoding a message, the receiver decoding it, and providing feedback. This feedback loop ensures clarity and mutual understanding, which are critical in high-pressure EMS environments. Table 4.1 highlights the significant ways age, culture, and personal experiences can impact communication. For example, cultural norms may influence eye contact or emotional expression. Understanding these differences allows EMTs to adjust their communication style, ensuring respect and effective interaction with diverse patients. Age, culture, and personal experiences shape how people communicate. For instance, in some cultures, maintaining eye contact shows respect, while in others it may be considered rude. Similarly, age can influence how quickly someone processes information. EMTs must adapt their communication style to each individual to ensure clarity and comfort. Additionally, tone, pace, and volume reflect the speaker's mood and the importance of their message. Ethnocentrism, or placing your cultural values above others, and cultural imposition, where personal beliefs are forced onto others, must be avoided. Remaining respectful and open-minded is critical for building trust and effective communication. Nonverbal communication is an integral part of interacting with patients. Body language, gestures, and facial expressions often reveal more than words. Being mindful of your own nonverbal cues, as well as interpreting the patient's, is essential for creating a supportive and effective dialogue. When treating a potentially hostile patient, your body language plays a critical role in diffusing tension. Stay calm and assess the safety of the scene before engaging. Avoid adopting an aggressive posture and make good eye contact without staring. Speak calmly, confidently, and slowly to project a sense of control. Above all, never threaten the patient, either verbally or physically. These strategies help maintain safety and build trust, even in challenging scenarios. Physical factors such as noise, lighting, distance, and physical obstacles can interfere with effective communication. For example, loud environments can make verbal communication difficult, while poor lighting may obscure nonverbal cues. Additionally, cultural norms dictate personal space, which can influence comfort levels during interactions. Remember, gestures, body movements, and your overall attitude play a crucial role in how the patient perceives you. Asking the right questions is fundamental to pre-hospital care. Open-ended questions encourage detailed responses, helping you gather more comprehensive information. For instance, asking, "What seems to be bothering you?" invites the patient to elaborate, providing critical insights into their condition. Closed-ended questions are also valuable in specific scenarios. These questions, which often require short answers, are useful when patients cannot provide detailed responses. For example, asking, "Are you having trouble breathing?" quickly identifies a key concern and helps guide immediate care decisions. Effective communication relies on a variety of tools. Techniques like facilitation, reflection, and empathy encourage patients to share more information. Tools such as clarification, confrontation, and interpretation ensure you understand the patient's needs accurately. Finally, explanation and summary help you convey information clearly and confirm shared understanding. During patient interviews, touch can convey care and compassion when used appropriately. For example, a reassuring hand on the shoulder can provide comfort. However, avoid touching sensitive areas such as the torso, chest, or face, as this could cause discomfort or appear intrusive. Certain interviewing techniques can hinder effective communication. Avoid providing false reassurance, giving unsolicited advice, or asking biased questions. Similarly, avoid interrupting, speaking in professional jargon, or using authoritative language. These missteps can create barriers between you and the patient, reducing trust and clarity. Friends and family can be helpful during the patient interview process, especially if the patient struggles to communicate. However, it's important to ensure the patient answers questions themselves when possible. If necessary, kindly ask others to step aside to maintain focus and privacy during the interaction. Following these golden rules can enhance patient communication. Make and maintain eye contact, introduce yourself, and use the patient's proper name. Be honest and use language they can understand. Also, be mindful of your body language, as it communicates just as much as your words. To enhance patient communication, always speak slowly, clearly, and distinctly. If the patient is hard of hearing, face them directly so they can read your lips. Be patient and allow them time to respond. Maintain a calm and confident demeanor to build trust and reassure the patient. Emotional intelligence refers to your ability to understand and manage your emotions while responding effectively to the emotions of others. It plays a crucial role in defusing conflicts, building rapport with patients, communicating effectively, and managing difficult situations. These skills are essential for EMTs working in high-pressure environments. The key attributes of emotional intelligence include self-awareness, self-regulation, motivation, empathy, and social skills. Together, these qualities allow EMTs to navigate challenging interactions, provide compassionate care, and foster positive relationships with patients and colleagues. Improving emotional intelligence involves self-reflection and mindfulness. Assess how you react to stress, focus on the present moment, and take responsibility for your actions. Additionally, consider how your decisions affect others to develop a more empathetic and thoughtful approach to patient care. The Behavioral Change Stairway Model, developed by the FBI for crisis management, provides valuable strategies for effective communication. These include active listening, displaying empathy, building rapport, exerting influence, and initiating behavior change. These steps are particularly useful when managing challenging patient interactions. When communicating with older patients, begin by identifying yourself and presenting yourself as competent, confident, and caring. Avoid assuming they are senile or confused. Older patients often require patience and compassion to feel understood and supported. You may encounter older patients who appear irritable, hostile, or confused. Do not assume this behavior is normal. These could be signs of an underlying medical condition. Approach them slowly and calmly, and allow plenty of time for them to process and respond to your questions. Look for signs of confusion, anxiety, or sensory impairments, such as hearing or vision loss. Ensure that your patient feels confident that you are in control and doing everything possible for their care. Remember, patience is key when working with older adults. Older patients may not always recognize or report significant changes in their health. For example, they may feel less pain than younger individuals. This makes it critical for EMTs to remain vigilant and rely on objective assessments to identify potential health concerns. When possible, give older patients time to pack a few personal items before leaving for the hospital. Remember to locate essential items like hearing aids, glasses, and dentures. Many older patients are concerned about the safety of their homes, belongings, and pets, so addressing these concerns can help alleviate their stress. Fear is often most pronounced in children, making effective communication critical. Children may be frightened by your uniform, the ambulance, or a crowd of people around them. Recognizing and addressing these fears is essential to gaining their trust and cooperation. To help reduce a child's anxiety, allow them to keep a favorite toy, doll, or security blanket. If possible, have a family member or friend stay nearby for comfort. When practical, let a parent or guardian hold the child during evaluation and treatment to help them feel safe. Honesty is especially important when communicating with children. They are quick to detect deception, so always tell them the truth, including if something may hurt. Additionally, respect their modesty to maintain their comfort and trust throughout the interaction. Speak to children in a professional yet friendly manner. Maintain eye contact and position yourself at their level to avoid intimidating them. These actions demonstrate that you are there to help and can be trusted, which is key to successful pediatric care. Many hearing-impaired patients have normal intelligence and are not embarrassed by their disability. Position yourself so they can see your lips, as this aids in communication. Be mindful of hearing aids, ensuring they are not lost or forgotten during an incident, and consult family members if needed. To communicate effectively with patients who are hard of hearing, have paper and pen available for written communication. If the patient can read lips, face them directly and speak slowly and distinctly. Avoid shouting, as it can be counterproductive and distressing. Additional steps include listening carefully, asking short questions, and giving concise answers. Learning simple sign language phrases such as help, hurt, or sick can also be extremely beneficial for effective communication with hearing-impaired patients. When working with visually impaired patients, start by asking if they have any level of vision. Many are not completely blind and can perceive light or movement. Always explain what you are doing as you perform each step to ensure they feel informed and secure. Maintain physical contact with the patient during care to provide reassurance. If they can walk, guide them by placing their hand on your arm. Additionally, ensure any mobility aids, such as a cane, are transported with the patient to the hospital. Guide dogs are an important source of support for visually impaired patients. If possible, transport the guide dog with the patient to reduce stress for both. If this isn't feasible, arrange proper care for the dog and communicate with the patient about the arrangements. Communicating with non-English speaking patients requires creativity and patience. Start by determining if they understand basic English phrases. Use short, simple questions and point to parts of the body to facilitate understanding. If available, enlist the help of a family member or friend to interpret. Consider learning key phrases in commonly spoken languages in your area, or using translation tools like smartphone apps or pocket cards. Remember to request a translator at the hospital to ensure accurate communication and continuity of care. Mission-critical communications refer to situations where any disruption could jeopardize the task at hand. In EMS, having a shared mental model, a clear understanding of what's happening among all team members, is essential. This alignment ensures everyone is working toward the same goals in patient care. To establish a shared mental model, key questions must be addressed. What is the patient's priority? What care has already been provided? What is their current state? And what are the immediate next steps? Answering these questions ensures clarity and avoids errors during critical tasks. Effective communication is vital during the handover of patient care. This process involves transferring both patient information and responsibility to another healthcare provider. Clear, concise communication ensures the patient receives appropriate and continuous care. When giving a handover report, make eye contact with the receiving provider to establish focus. Minimize noise and distractions in the environment to ensure your message is clearly understood. Always address the ABCs to highlight any immediate patient needs. A structured handover report should include the patient's situation, background, assessment, and treatment, often summarized using frameworks like SBER or SBAT. Provide thorough documentation detailing the patient's priority condition, prior care, current state, and immediate needs. Receiving a handover report requires active listening. Maintain eye contact, ask clarifying questions to ensure understanding, and summarize the information to confirm accuracy. Additionally, gather any supplementary documentation to provide comprehensive ongoing care. Patient care reports, or PCRs, are essential legal documents that record all aspects of patient care from dispatch to hospital arrival. PCRs can be written or electronic and are critical for documenting the care provided during an EMS call. PCRs serve multiple purposes, including ensuring continuity of care, compliance with legal requirements, administrative tracking, reimbursement, education, and data collection for quality improvement and research. Completing accurate PCRs is a key responsibility for EMTs. When completing a PCR, gather detailed information, including the chief complaint, mechanism of injury or illness, level of consciousness, vital signs, patient demographics, and details about transport. Administrative data like the times of key events, such as dispatch, arrival, and hospital transfer, should also be recorded. When completing a PCR, gather detailed information, including the chief complaint, mechanism of injury or illness, level of consciousness, vital signs, patient demographics, and details about transport. Administrative data like the times of key events, such as dispatch, arrival, and hospital transfer, should also be recorded. Patient care documentation uses two main forms: traditional written forms and electronic PCRs, EPCRs. Written forms include checkboxes and a narrative section for details, while EPCRs streamline documentation with prompts and easy sharing. Both require accuracy and professionalism to ensure quality care and compliance. Standardized narrative formats provide a clear and organized way to document patient care. Common methods include the chart format, which focuses on the chief complaint, history, assessment, treatment, and transport, and the SOAP format, which highlights subjective observations, objective findings, assessment, and plan. These structures ensure that all critical details, such as timing, patient conditions, treatments provided, and observed changes, are accurately recorded for continuity of care and legal compliance. Health Information Exchanges, HIEs, improve data sharing between EMS providers and other healthcare entities. They streamline care by reducing duplication of efforts and enhancing access to patient information. This ensures better outcomes and supports continuous quality improvement. HIEs often follow the SAFR framework. Search for records, alert hospitals of incoming patients, file data into patient records, and reconcile data for billing and quality improvement. Ensure documentation is accurate, as errors can compromise patient care. If you make an error in documentation, draw a single line through the mistake, initial it, and write the correct information nearby. Transparency and accuracy are essential for maintaining legal and professional standards. If an error is discovered after submitting the report, follow the same process to correct it. Avoid covering up mistakes, as this can lead to severe legal and professional consequences. Thorough documentation is critical when a patient refuses care. Record assessments, care offered, and the patient's refusal. Obtain signatures from the patient and a witness, such as a family member or law enforcement, and ensure the patient understands the risks of their decision. Certain incidents, like gunshot wounds, dog bites, abuse suspicions, or mass casualty events, require additional documentation. Follow local protocols to meet legal and administrative requirements, while ensuring all critical information is included. EMS communication systems include radios, telephones, and digital tools, enabling coordination between providers and other emergency services. Familiarity with these systems ensures efficiency, teamwork, and safety during emergencies. Base station radios are fixed communication hubs that facilitate direct contact between dispatch and field units. They play a central role in coordinating resources and ensuring effective communication across agencies. Mobile radios, installed in vehicles, allow EMTs to communicate with dispatch and medical control while on the move. Ambulances often have multiple radios for redundancy and multi-agency coordination. Portable radios are handheld devices essential for maintaining contact at incident scenes. They are particularly useful during mass casualty events and when EMTs need to communicate away from the ambulance. Repeater-based systems extend communication range by receiving and retransmitting signals on different frequencies. This allows units that are out of direct contact range to communicate effectively. These systems use their greater power and antennae to bridge communication gaps, making them invaluable in remote areas or during large-scale incidents. Digital communication tools, like telemetry, allow electronic signals to be transmitted to hospitals. For example, cardiac monitor data can be sent via Bluetooth, enabling real-time collaboration and improved patient outcomes. Cellular phones provide reliable communication for EMTs, while satellite phones are a vital alternative in remote areas. Both ensure continuous connectivity during patient care and emergencies. EMS systems use various tools, such as public address systems and two-way radios. These enable effective communication within teams and across different agencies during emergency responses. Advanced tools like mobile data terminals enhance capabilities by providing dispatch data, real-time mapping, and communication interoperability for seamless coordination during incidents. The FCC regulates EMS radio operations, ensuring compliance with frequency allocation and licensing standards. Regular equipment checks are vital to maintaining reliable communication in emergencies. Dispatchers assign EMS units to calls, prioritizing based on urgency. They coordinate with other public safety services and provide instructions to the caller to assist before EMS arrival. Dispatchers also direct units to appropriate resources and manage communications throughout the call. EMTs must report updates, such as arrival at the scene, to ensure coordination. Any issues or challenges encountered during the call should be reported back to the dispatcher promptly to ensure ongoing support and resource management. Medical control facilitates patient care by providing guidance and ensuring hospitals are prepared for incoming patients. Accurate and timely communication is critical for effective coordination. Consulting with medical control can help EMTs request orders, clarify treatments, and notify hospitals of special situations, ensuring optimal patient outcomes during transport. An effective patient report includes your unit identification, the patient's age, gender, chief complaint, and a brief history of the issue. Clearly communicate critical details to prepare the receiving facility. Include findings from your physical exam, care provided, and the patient's response to treatment. Conclude with any questions or special instructions from the receiving facility to ensure seamless handoff. Medical control, either online or offline, provides oversight for treatments, transport destinations, and complex care decisions. EMTs must always confirm orders before acting. In many areas, medical control is provided by hospital physicians. Variations exist, including freestanding centers or individual physicians, depending on local systems. Access to medical control is managed through dispatcher-assigned channels. Centralized coordination ensures clear and efficient communication during emergencies. Provide precise, relevant information during calls, avoiding codes unless required by local protocol. This ensures accurate understanding and effective collaboration. Repeat orders back to confirm accuracy and question any instructions that do not seem appropriate. This ensures patient safety and adherence to protocols. special situations, like hazardous materials incidents or rescues, require early hospital notification. Provide details on patient numbers and any specific needs to prepare resources. Follow your system's established response plan for special situations. Clear communication ensures hospitals and agencies can respond effectively to complex incidents. Check all radio equipment at the start of your shift to ensure functionality. Having a backup plan for equipment failure is essential for maintaining communication during emergencies.